Hello and welcome to the IHSS Caregiver Education on Personal Care created by Donna Banang, Terry Kim, Sally Le, Bethany Leung, Vivian Liu, and Carrie She, nursing students at the University of California, Irvine, and presented by Bethany Leung and Terry Kim.
This project is supported federally by the Health Resources and Services Administration and the UCI School of Nursing Division of Geriatric Medicine and Gerontology.
This presentation will include information on bowel and bladder care, skin and nail care, safe bathing, and oral and denture care. We will be going over bowel and bladder care for those with healthy bowels and bladders, and also care for those with common problems associated with incontinence, constipation, and infections. Those who have normally functioning bowels and bladders are considered continent. They are able to control urination and defecation. Clients who are able to walk should be assisted to the bathroom toilet. Clients who are mobile but unable to walk a distance should have a bedside commode. And clients who are chair or bedbound should have a bedpan or urinal. When assisting continent clients, always be present and respectful. Offer toileting every 4 to 8 hours. Know the minimum amount of urine in 8 hours should be 1 cup, and recognize that clients are expected to have a normal bowel movement every 1 to 3 days. Next, we will be discussing common problems. Urinary incontinence is when a client is unable to control urination. It results in leakage of urine when a person laughs, coughs, or lifts something heavy. This frequently occurs in older adults. It can be caused by high pressure inside the bladder, weakened sphincters, nerves sensing bladder fullness that are not fully functioning. Studies have shown that weakened pelvic floor muscles are a common cause of incontinence, in which case performing pelvic floor exercises will help. In the case of incontinence, there should be the use of disposable adult briefs and pads. It is important to clean the area with warm water and clean cloth after each episode and dry thoroughly to prevent skin breakdown. In addition to urinary incontinence, bowel incontinence is another problem. This occurs when the client is unable to control defecation or bowel movements. Another common problem is constipation. It is the absence of a bowel movement for more than 3 to 4 days. Common causes of bowel incontinence include excess amounts of alcohol, caffeine, fatty and fried foods, or sweeteners. Common causes of constipation include low dietary fiber or fluid intake, changes in eating and exercise habits, or ignoring the urge to defecate. Several ways to respond to these bowel problems like constipation include altering the diet, increasing fluid intake, exercising, and establishing a routine. Urinary tract infection. UTIs occur when bacteria from the rectum infects the urinary tract. These will cause great discomfort for the client and require treatment. Symptoms include frequent urination, urgency to urinate, pain or burning while urinating, stomach or back pain, and cloudy or bloody urine. It is important to make sure the client stays hydrated and urinates when the need arises. Be sure to wipe from front to back and practice good hygiene techniques. We will now be showing an animation on urinary incontinence by the UCSF Division of Geriatrics. This video would further explain and assist in teaching you how to care for a loved one experiencing urinary incontinence.
This video is designed for caregivers of older adults with dementia who have urinary incontinence. Urinary incontinence is defined as any leakage of urine or inability to get to a toilet in time. If your loved one has new urinary incontinence, discuss it with a doctor. There may be reversible causes, such as bladder or kidney infection. In men, history of prostate cancer with radiation or surgical treatment can be a cause. In women, decrease in strength of the pelvic floor muscles, and an overactive bladder are common causes. The following are some strategies that might help to decrease incontinence episodes. Timed urination, or timed voiding, can help regulate your loved one's use of the bathroom. The goal is to prepare your loved one to use the bathroom on a regular schedule. However, this can take time and effort. Start by providing gentle reminders to your loved one to use the toilet at short time intervals. If your loved one is using the bathroom or having accidents every 2 hours, start out by deliberately reminding her the opportunity to go to the bathroom every 2 hours. Gently lead her to the bathroom and encourage her to use the toilet even if she does not initially feel the need to go. After a few days, stretch the time interval between the trips to the bathroom by 15 to 30 minutes. Eventually, your loved one may be able to extend the time between bathroom trips to 3 or 4 hours. Remember that time voiding will not be successful overnight. Do not argue with an older adult who does not want to use the bathroom, but instead use gentle reminders or commands, such as "let's go to the bathroom," rather than asking. This technique may not work in older adults with very advanced dementia who can no longer respond to requests, and may increase agitation due to their inability to understand what the caregiver is asking. Getting up to use the toilet at nighttime can increase the risk for falls and disrupt sleep. For safety, remove all obstacles such as rugs that might make the ground uneven. Set up motion sensor night lights to help your loved one see in the dark. If possible, move the bed so that your loved one can see the bathroom from the bed. Consider painting or labeling the bathroom door. Disable locks so that your loved one cannot accidentally lock herself in the bathroom or bedroom. Some older adults who suffer from incontinence or frequent urination think that decreasing their fluid intake will decrease their need to urinate. However, drinking enough fluids is important to maintain metabolism and kidney function. Do not deny your loved one liquids if she complains of thirst. Avoid liquids that are bladder irritants, such as tea, coffee, or sodas. Also avoid drinking fluids near bedtime. Go over your loved one's medications with a doctor. Some medications can increase the need to urinate, such as diuretics, commonly known as water pills. If your loved one must be on a diuretic, consider changing the schedule to nighttime when your loved one sleeps. If nighttime urination is a problem, then take the diuretic during the day and use the toilet on a schedule. Urinary incontinence often leads to fear of having an accident or not being able to find a public restroom outside. These fears can lead to social isolation and depressed mood. Don't let this problem keep your loved one at home, but do take steps to prepare for incontinence outside of the home. Using disposable garments such as pads or diapers may allow your loved one to feel more secure about leaving home. Pack a bag with a change of underwear and clothes, disposable wipes, and extra pads or diapers to ensure that your loved one can clean up easily in the event of incontinence. There are also various cell phone applications that can locate the nearest public restrooms that may help reassure your loved one. We hope these tips have been helpful. Talking to other caregivers of older adults with dementia may give you other helpful tips on preventing and managing incontinence. Consider joining a support group for caregivers. Many older adults suffer from incontinence, so you and your loved one are not alone.
We hope that video gave you new information and provided insight in how to support and care for your loved one. Next, we will be talking about skincare. Skincare includes checking the skin on a daily basis, bathing using warm, not hot water and mild soap, rinse off soap thoroughly, using moisturizers for dry skin, keep skin clean and dry, and being extra careful to assess and treat incontinence. Skincare also includes promoting good nutrition and hydration. Encourage well-balanced diets and proper fluid intake. Adequate amounts of protein, calories, vitamins A and C, zinc and iron are necessary for healthy skin. Pressure ulcers are sores caused by constant unrelieved pressure to the skin and underlying tissue. This picture shows the common locations where pressure ulcers form that people should be aware of. Pressure ulcer risk factors include advanced age, lack of mobility, poor diet, moisture on the skin, diabetes, and friction and shearing. To reduce the risk of pressure ulcers, people that have a decrease in mobility should be repositioned every 2 hours or more for those with higher risk. Use soft sponges or cloth when washing. Use moisturizing cream and be sure to thoroughly dry all areas. Next, we will be discussing nail and foot care. The best time for nail and foot care is during the bath. Inspecting feet is very important to do with diabetic patients. Look out for wounds, cuts, redness, sores, or swelling, and watch to make sure they are healing properly. Daily foot care can prevent cracks and infection. Make sure to dry feet all the way and apply a moisturizer to prevent dry skin. Make sure socks are clean and fit properly to prevent any rubbing. And this is a little pictorial on how to wash your hands. Washing hands is important because it is one of the most effective ways to prevent the spread of germs. Start by wetting your hands, apply some soap carefully, rub your hands palm to palm, lather the back of your hands, scrub between your fingers, rub the back of your opposing palm's fingers, clean your thumbs repeatedly, clean your fingernails and fingertips. The rubbing with soap process should last about 20 seconds. Rinse your hands thoroughly, dry them with a disposable hand towel, and then use the towel to turn off the faucet.
Now we will further discuss by talking about safe bathing. For safer bathing, clear unnecessary items, make sure everything is accessible within reach. Consider having grab bars, shower seats, and non-slip bath mats in your shower or bath to decrease fall risks. Prevent burns by keeping water at a safe temperature. Handheld shower heads, and never leave a confused or frail person in the tub or in the shower on their own. Bathing doesn't have to be troublesome. Have a set routine and make it relaxable and enjoyable experience. Take away distractions, put on some music, and keep the room nice and warm. One way to have an enjoyable experience is allow the patient to have a preferred time to have a bath. Next, we'll discuss sponge bath for caregivers. If bathing is too difficult or unsafe, a sponge bath may be a different but equally acceptable option. When giving a sponge bath, only uncover the body parts you are washing. Prepare plenty of towels, washcloths, and warm water. Start with cleaner areas first, and save dirtier parts for last. Give person as much independence as possible. Ask if there is anything they can confidently do on their own, and let them. And now we will show a video on how to give a sponge bath.
We begin. First, let's start by putting the waterproof bed pad under them. If you are using a garbage bag, put a towel on top of it to absorb water and protect their skin from the plastic. Now, all we have to do is wash, rinse, and dry. Here's how we do it. With one cloth, use soapy water to wash. It can be helpful to wrap the cloth around your hand like this, but you don't have to. With a fresh cloth, use clean water to rinse. Finish by patting each area dry with a towel or face cloth. We'll start by washing their face. Remember to be gentle. Facial skin is sensitive, so avoid harsh soaps and opt for a gentle cleanser or even just plain water. When done washing the area, switch to another cloth in the clean water to rinse. Then pat dry with a towel or clean cloth. Once you get this technique down, you're good to go with the rest of them. Next, we'll help the person you're caring for wash their neck, chest, stomach, arms, and hands. Pay close attention to any skin folds or under breasts, and make sure they're dried well. Being confined to bed can be very hard on the skin, so be sure to pat the skin dry instead of rubbing, like this. Now, let's wash their legs and feet. Make sure that the areas between their toes are dried very well to avoid fungal infections or skin issues. Now, we've arrived at the last part. Helping to wash someone's private areas can be a really uncomfortable task, but properly cleaning this area is very important to prevent infections that could lead to hospital stays. With a fresh cloth, start washing their private areas in the front. Always work from front to back. When you're finished washing the front, discard the used washcloth and help them to roll onto their side away from you. Putting a pillow or rolled up towel under the pad will help keep them propped up on their side while you work. Now we grab a fresh cloth to wash their back and then their bottom. If you need a more detailed tutorial, check out our other video on how to wash someone's private areas. If the person you're caring for has dry skin, it's nice to apply lotion after you're done with the bath. Assisting someone to wash in their bed does not have to be difficult. With some practice, following these steps, you'll be a pro in no time.
Now we will continue by discussing oral care. Daily oral care is essential to prevent tooth decay and gum disease. Encourage drinking water or chew on sugar-free gum. Saliva helps remove any bacteria debris that can cause infection. Encourage using mouthwash as well. When cleaning the teeth, observe for any changes in the oral cavity. Be aware of special precautions such as choking. Make sure patient is in an upright position. Clean as often as natural teeth every day to reduce risk for gum infection. Remove and rinse after meals. Make sure to rinse the dentures thoroughly after soaking in a denture solution overnight, not a regular toothpaste. When dentures are removed, clean tongue, gums, roof of mouth, and natural teeth with a soft toothbrush. When you are cleaning dentures or partials, be careful not to drop them. If you clean them over a towel, you can prevent breakage if they drop in the sink or onto the floor. Regular toothpaste are too abrasive and may damage dentures. Don't use bleach to remove any stains because it could discolor the pink portion. You can use a mild dishwashing liquid to clean dentures if commercial dental cleansers are not available. Never use hot water for dentures since they can warp. Always store dentures in a denture container with water to keep moist. They should not be allowed to get dry or lose their shape. Thank you for joining us on our IHSS education presentation on personal care. If you have any questions, please feel free to email Professor Jung-Ah Lee. Thank you.